Hey, hey, come on in. How are you doing? Welcome to the live. How are you? How are you all doing? Who's in here? Good afternoon. Give people a few minutes to get in here. How are you doing? Share with anybody that I am live tonight. Do you have any questions? Please comment and share. And who's here tonight or this afternoon? Here to answer your nursing questions. Who is here tonight or this afternoon? How's everybody doing? Welcome, welcome, welcome. Today, we're going to talk about some nursing history a little bit so that you all know where we all came from in nursing. Definitely comment, like, share, let people know that we're out here. Who's here today? Nursing questions is what we're going to talk about in history. Waiting on people to come. Hey, come on in, come on in. Hey, hey, hey. How are y'all doing? Today, we're actually going to discuss some nursing history a little bit and answer some of your nursing questions. So, what do you have for today? Who's on today? Who is on? I need you to definitely comment, like, share. Definitely share so that people know we're on for tonight. I'm on either every Friday or Saturday. I'm good. How are you? I'm doing very well. What are you doing today? Are you working today, or what's going on with you today? Is it Miss Malno? I think, or Mayno? How are you doing today? Are you working? Off? Going to school? What you doing? Oh, okay. Good. Good. Well, I am getting ready to actually start school here in the next 3 weeks, I want to say. So start school not for myself to teach. So I'm about to go back to teaching. My break's about to be over. That's good. So what classes are you taking? What classes are you taking? Finish up your accelerated BSN. Okay. How many months is your program? I was interested in learning more about the ABSN programs. How many months was your is your program? And are you coming from a another degree? Do you already have a degree in something? 15 months. Okay. Hi, how are you doing? Is it Sahara? I'm not sure how to pronounce your name. Ali? 15 months. Okay. Oh, in biology. Okay. So you already had a degree in biology and you're like kind of they took your credits, some of your credits, that way you could do this accelerated program. Is that how that worked? Ali, how are you doing today? What brings you here? Thank you for joining my live. Okay, good. That's actually a very good amount of credit hours for your program. So when will you be finished? Because I wanted to talk a little bit about, oh, August. Oh, next month, August? Congratulations, if so. Next month, August? Yes, good, good. Graduate next month. That's exciting. Do you already have a job lined up? Do you have a job lined up already? And if so, what's your specialty that you're trying to go into? Oh, mother baby, which is what I do, or NICU. I understand. Okay, good. Hopefully, you'll get a good preceptor when you get to the hospital that will really teach you and teach you well about what you're getting yourself into in terms of mother baby or even the NICU. Sometimes they make you go do nursery first, like just nursery, and learn how to do nursery for about 6 months to a year, and then they will transfer you or cross train you into NICU if that's what you all decide to do. So don't be upset if they say you need to go to the nursery, to the well baby nursery for a year first, or even 6 months first. Sometimes they require you to go into an area for 6 months, and then they'll cross train you into, let's say, NICU if that's what you wanted to do. Or if they have like transition, I guess what I'm saying is whatever position they got open in that area of OB, try to take it. That way you can cross train into another one. Because what ends up happening is, let's say for instance, you really want mother baby as an example, and they don't have any, but let's just say they have labor and delivery open as an example. And that may not be what you want to do, but it will give you a foot in the door, so to speak. So if they give you L&D and they're willing to train you, take that one too. Just take it, get through your first year, and just go ahead and tell the manager, I'm wanting to transfer into or cross train into mother, baby, NICU, whatever happens to be. And if they don't transfer you or cross train you there, find you another hospital. But if you want to get into OB, I will say this: anybody who wants to get into OB, you want to go ahead and get a job wherever you can get it. Because what ends up happening if you get too picky and say, I only want to do this, I only want to do that, you're not going to get a job. And then you'll have a hard time because then people say, well, I want somebody with experience. And so you'll have a hard time having experience or getting experience when you don't have any. So definitely um, take whatever they give you and then, then have your demands going on later on once you finish. Who else is here today or tonight? Yeah, definitely do that. I always tell people get in where you fit in, especially if it's within the OB realm. Even if it's not what you want to do, just know that you have a bigger plan down the road. So, like I said, if you want, maybe you say, I hate L&D. I don't want to do L&D. I never thought about L&D. But if that's where they put you because they have an opening, take it. Because let me tell you, if you could be what I call the triple threat, meaning you could learn nursery, OB, and postpartum, you can get all kinds of travel assignments later in life. If you decide to travel later in life, if you can do all three, you are marketable. So the more you can do, the more marketable you are. So go ahead and get a job somewhere first. I just checked in. What is your take on starting? Um, I Hey, Miss Renee. Everything's going good. How are you? Well, the thing is, if they will hire you for NICU coming straight out the gate, that's great. But sometimes they won't because they want you to have a foundation first, especially as a new grad. So they may say something like start off in the well baby nursery first or do mother baby first for about 6 months to a year. And then they will cross train you into NICU because that is a critical care area for sick babies. So they may not want to train you. Now, all hospitals are not like that. So I'm not going to say that that's going to be your situation, but don't be surprised if they say no, we're not willing to train you into NICU straight out the gate. Some hospitals do, but I don't want you to get your hopes built up and then it don't happen. So have the mental mindset that I'll have to go somewhere else and then maybe they'll cross train me later on into NICU, if that's the case. Miss Renee, how are you doing? How are you all doing tonight? How's work going for everybody? Work, school, vacation, life, whatever. How's everything going for you all? I kind of wanted to talk a little bit about y'all understanding the history of how Florence Nightingale. If y'all been to school, you know that Florence Nightingale is the hallmark of nursing. But truth be told, she really had an issue with minorities and she had an issue with men in nursing as well. So she is someone who did not want men particular in nursing because of the fact that she felt that men were only good for one thing and they were only good was to help us do stuff, which is what we use men for today. Um, yes, really. Um, are you talking about when you say really, you talking about Florence Nightingale? You won't learn this in school, and you're like, depending on who your instructors are, you won't learn the truth behind it because of the fact that they're going to teach what they want to teach. They're going to push their narrative. It's like politics, basically. But I happen to teach this to my intro students, so I happen to know that Florence was not a component of men, especially men and minorities being in nursing initially. Um, Men, specifically men, the issue was again, they were the help. They're kind of how we use them for today. They're how we use them for today. When we have men on our units, think about it, ladies. When we have men on our units, what do we need them to do? We go, can you help turn this patient? Can you help do this? Can you help do that? That was the intent of men back then. She actually had them. If you think about, I don't know if y'all ever watched like psych movies, but movies like, have you ever heard of the word or orderly? You see them in psych movies. Like you'll see a man in a all white outfit, and somebody crazy in this movie it happens to be, and you see these men who come up, typically white men, come up and drag them to the asylum or whatever it happens to be. That was the idea of what men were supposed to be in nursing. So if you think about those kind of movies, um, so the thing with that is, men didn't come into nursing until later because of the fact that they was coming from the wars. There was a lot of wars that were going on. I'm not good with history in terms of which war it was, but the war itself, they would come into wars and they would start taking care of people and things like that. And then he's a nurse ratchet, and they would take care of people. And as a result of that, they really found their way into nursing as really, really, found that this to be a great lucrative career. Nursing as it is today, men often come in typically as second career students. into this career. A lot of them are former military. They used to be teachers. They used to be engineers. So again, just like back in the day when they came in military into nursing, it was a second career. It was kind of like a stepping stone into something else. So yeah, Florence was not as nice as we like to portray she was. She was a proponent for nursing to look a certain way, and men were not included in that. And minorities were not either. So, hey, Mr. Tighten Up. Such about talking about. I saw there's no training camp. I'm not happy about that. I wanted to go to the training camp to see what they were doing. But Miss nursing school starts so in the fall. Is that next month fall, like August? So you know what? Let's talk about it. Let's talk about it. Miss Renee, what to talk about in terms of what nursing school is kind of like? When you go to nursing school, you're gonna think, how long have these instructors been here? Because every single semester, it seems like they are disorganized. I remember starting nursing school in 2004, and I really thought that my nursing instructors were so disorganized. I'm like, y'all do this every single semester or every year, or every how often? How are y'all so disorganized? How y'all do not know what y'all supposed to be doing? And it just seems so disorganized. However, just now that I teach it and I'm on the other side of it, I see it for what it is. It is disorganized because you have a new group of students coming in every single semester or every single year to a program, and you have to get them acclimated. And then once you get that group settled, you have to then push them through the program, through the cohorts. So what you can expect, one thing I don't want you to think of, do not think it's like general education classes, because it's not. So the classes that you already took, like your psychology, your science classes, your math classes, statistics, whatever all you had to take, your English classes, don't think of it like that. Nursing school is a whole new beast. It has nothing to do with the only thing those classes do for you, besides your anatomy and physiology and microbiology, um, and patho if you had to take it. The only thing the other classes do for you is just make you more well-rounded. But in terms of directly relating to nursing itself, that's all it did was provide a foundation to make you more well-rounded. Nursing school is a different beast because it's a professional program. And when you have a professional program, you're being taught something different. So I always tell people, if you are used to making A's, so let's say you made all A's and B's in your other classes, and you find yourself making C's in nursing school, that's normal. That's normal. You may even fail your first few tests. And I'm not trying to wish that up on you, but that's just kind of the nature of how nursing school is. Majority of the time, my students fail their first few tests until they get acclimated to the program and how to answer nursing style questions. And so I'm going to kind of break it down to you, Miss Renee, that when you come into nursing school, you're going to be like, oh, I don't understand this level of questioning. Well, when you took your general education classes, um, you took you it's called Bloom's taxonomy, and you had basically certain um, kind of questions that you got, and you got applications, or not applications, you got knowledge based questions. So the knowledge based questions are basically regurgitating facts. What is the definition of? What does this mean? Things like that. When you get to nursing school and professional programs, you get into knowledge based questions. So they want you to be able to talk about how to handle a situation. Hold on, let me see. You said we made a group saying how previous graduates were saying how unorganized. Yes. So yeah, but go in already knowing it's gonna be unorganized. Every cohort is different. Every single semester that I start next month myself. I start teaching next month, and guess what it's gonna be? Disorganized. I know how to teach my class, but the thing is, you have students who are coming in just like you, who don't know the routine, who are gonna come with a lot of questions. And I'm not saying there's anything negative about the questions, because you should have questions, but they're gonna come in with a lot of questions. They're gonna come in because it's not like taking English class. It's kind of like, and you're no way a child, but it's kind of like a child going to kindergarten for the first time. They have no real framework. They could have came from preschool, and preschool could have been one thing, but when you get to this big old kindergarten class with all these other kids, and the teacher looks different, and they have a routine and a schedule, a different schedule what you're used to, it's kind of like learning all over again. And that's kind of what nursing school is kind of like. So that very first semester, you're going to spend a lot of time trying to get to know your instructors, trying to get to know your other fellow students, and trying to get to know what the routine happens to be. And I have a lot of my students who would tell me after the first semester, I've preached and preached and preached about, listen, you may not be able to work as much. You cannot party as much. You're going to have to go ahead and make sacrifices and things like that. They don't believe me till they start failing all these tests that they have. Then they're like, what should I do? I said, I already told you. You're going to have to sacrifice something. Is you're having a different experience, like I want to experience for myself and have my own opinion because you may not, but they're not lying to you. So I don't want you to think that they're lying to you because they're not. It is very much unorganized until we can get it together. And once we get it together, then you're kind of like, okay, I get it. So second semester for you, you'll be like, okay, you know what? I know some of the instructors. And then by the time you get to say third and fourth semester of your program, by then you would have rotated through most of your instructors, so you don't have the anxiety of getting to know instructors all over again. You're like, okay, I know her teaching style. I know he or she is strict. I know they don't play. I know this one does play. They let me do whatever I want to do. You learn that already, so you can take that anxiety away from you. Learning something and learning somebody new is very exhausting, and it's very it causes anxiety. It just causes anxiety. How to pay for nursing school like I'm a standstill. Federal loans only pay for half. To be honest with you, nursing school, if you can't find a scholarship, scholarships, grants, and loans and work. Those are the four ways to pay for nursing school. So either scholarship that you can get grants, of course, loans that you know about, and then the other part of it is just working. Is it possible for you to go to school part time, or is it a traditional program where you have to go on a set schedule? Because that right there may be something that you have to consider when going to nursing school, um, or find even another program that's cheaper. And that's where you have to go and Um, do your research about how much nursing schools cost and see which one is more affordable to you and see how if they allow a payment plan. Because when I this is not related to your program, but when I did my doctoral program, my program had a payment plan. So I had loans for my very first year of my doctoral program, but then after that I paid out of pocket. And I paid, I made a payment plan based on this schedule that they had where the earlier I started my payment plan, the less I had to pay each month. And then I had to pay it off by the end of the semester. And then it started off the next semester. So maybe check and see too if the financial aid department has a payment plan where you can work and pay it as you go. It is harder to do that way, but you won't have the student loan debt either. So that's something to be mindful of. That's what I did. I know a lot of us, some people work and save, some people borrow from people, some people get the grants and scholarships. So that's the best advice I can give you in terms of getting money for nursing school. And then, I always tell people what's hard about that situation is I tell people it's not really a good idea to work while you're in nursing school either because nursing school is very hard. Nursing school is probably one of the hardest things I've ever done. And to be honest with you, my BSN program was harder than my master's program. The master's program was not easy, but it was hard in a different way. The only thing that was really hard about my master's program is the fact that you could not make a C in the master's program, and I had to be a better writer. But outside of that, hands down, the BSN program is one of the hardest programs to get through. So I truly advise you to spend a lot of your time not working if you can, or at least work maybe PRN somewhere if that's possible, or work part time somewhere where they're flexible and understand your work schedule. So that's something I would definitely recommend too in terms of working. So be mindful of that. What other questions do you have? And then back to Miss Renee. Also, when you are planning, make sure you're planning for your clinical as well, meaning that your clinical days, you're going to be, depending on your rotation, between 4 to 12 hour days. I don't know if you have children or not, but you want to go ahead and plan for a sitter if you have children. One thing I tell all my students is this is not the time to be getting, I mean, I'm not sure if you're pregnant now, but this is not the time to be getting pregnant. This is not the time to be getting married, getting divorced, buying a house. It's not time to do nothing that costs anything, costs stress. You don't want to do anything like that while you're in nursing school because it just causes unnecessary stress. Getting pregnant causes unnecessary stress. I had a student just last semester who she thought she was. She came to me thinking she was pregnant and she wasn't. But the stress that it put her under those 3 days for what she was trying to find out, nursing school was no joke when she wasn't pregnant, when she really thought she wasn't pregnant. So those are things that you don't want to do either. You want to either have a plan for children, because when your school schedule says, okay, well, you know what, we have inclement weather, the children are going to be out of school today, or your children are going to be sick, or something like that. Them nursing instructors don't care. Clinicals don't. It don't matter. You're gonna have to find somebody to keep them. They don't have this. Well, you just what you know. Well, my child is sick. Okay, well, you have a clinical unset or you have an unexcused absence because you're supposed to be here. They don't care in nursing school. So I don't want to make it seem like it's a bad place, but it's just that serious because they take it like what you're going to do when you go to work. What are you gonna do when you go to work? You're gonna have to find a someone to take care of your children while you're at work. So nursing school doesn't play that way either. You could be saying that you go to a funeral. Um I remember this is a lot of information, um, but I remember so one of my students, or no, a classmate of mine was in a car accident, and she was in the hospital because of her car accident. And the instructors just told her, "Do you need to withdraw from the program?" Because she couldn't. They was not going to allow her to miss her assignments and things like that. They don't play about stuff like that. So we have a plan for that. How to pass patho. So pathophysiology is not one of those easy classes to take. This is what you need to do. You need to break that stuff down into systems. Okay. So whatever the system they're working on, whatever system they are working on at that point in time, you need to understand it at a level in which you could explain it to somebody else. So some people learn best by flashcards. I learn best by pictures. Or you can go to places like Quizlet, and Quizlet has cards, they have questions, they have different things on there that you can quiz yourself on that type of information. Get you one of those. I don't know what they're called. I don't even have one, but they have like a lot of people put them on their clipboards where it has like a general overview of a certain content of something. Get you one of those and put it on a clipboard that you have when you have to be able to look over certain systems. Pathophysiology for me was one of the hardest things I had to take. I had to take advanced patho in my master's program and failed it the first time and had to take, well, I didn't fail it. I was failing it and withdrew from the class. And then I started it again the next semester and passed it. Patho is no joke. No joke. And no more kids until I have it together. You're absolutely right about it. Yes, yes, yes. So you have a child. So make sure you just have a plan for him for clinical or even for class because they don't play about that. So have a plan for him. Have a backup plan for somebody who can watch him when he's sick. And matter of fact, have two or three people lined up. Like, hey, you have a neighbor, somebody who can say, okay, if he's in school, I don't know how old he is. When if they get out of school early today, if something happens, can y'all watch my child for me or whatever? I'll pay you. Have a plan because nursing school don't care. And then, I will say when you get to nursing school, don't be afraid to ask questions. When you ask questions, um, when you ask questions, some people may be annoyed by that, but your instructors will, some of them, will be receptive to your questions because they're going to want to make sure and know that you are here for the right reasons, that you want to learn what it is to be a nurse. And so definitely ask questions to your instructors when you have questions or inform groups. You said you have a group chat. I think you said a group me. You said that you all have. Definitely, if you need to find somebody in that group me and get close to him or her, and you all become study partners. So that way, when and what I call them is accountability partners. I had an accountability partner. So she kept me on my toes. When she got her, you have discussion boards that you have to do. So when she got her discussion board done, she said, "Hey, I got my discussion board done." That prompted me to get on my discussion board. Or I say, "Hey, do you know how to do? Did you get this done? Did you start on the report?" No, I haven't did that yet. Okay, well, let me go ahead and get that done. We just kind of we it's kind of like having an exercise accountability partner, someone to keep you on your toes, make sure you stay on point, and find you somebody like that, and then definitely keep up with them the entire program. As long as they are doing you well and you're doing them well. If it doesn't work, it doesn't work. Find somebody else. But find you somebody that can be your best friend at least while you're in school. And a lot of times you build lifelong friendships with these people that you're in your school with. So I'm glad that you're starting school next month, Miss Renee. And uh, is it a mall? Are you in school right now, or are you in your prereqs? If y'all don't mind liking this, so we can get it out to other people and share and all those different things. So, what's going on with everybody else? We have 11 people here. What's going on with everyone else? Anybody else in school, or anybody else who was looking to start school or in their prereq classes, anything like that? Thank you so much for whoever liked it. Thanks so much. Nursing school is no joke. I tell you, it's no joke. So it's just one of those things where, you're like, okay, am I willing to make the sacrifices that I need to make for school? And if so, then This is what you need to do, meaning that there's very seldom that you get to go out. You don't get to go out as much. You have to. I will say this: you may lose a few of your friends too. We talked about this last week. We talked about somebody who had commented that um, her family was totally against her being in nursing school. So you may have to definitely lose some people along the way. Miss Lunsford, I start August 16th. Okay, great. So you start in about a month from today, literally a month from today. Okay. Are you excited about it? Okay. Amal, you start in 22, spring of January. So you don't have long either. Okay. Statistics. How's that class going for you? I didn't like that class. How are you liking statistics? The sad thing is, it's great to know, but you don't really need to know it for school. Is that bad? The statistics is that bad? Yes. I think I got a C in statistics, and I was happy with that. I was happy with my little C in statistics. I'm like, I ain't gonna take this class again. Y'all can people who like that, that's great, but the statistics was not my class. And I took it again in my doctoral program, and it still was not my class. It is tedious. If you ever take epidemiology later, for whatever reason, like in terms of maybe your master's or your doctoral program, that class right there, that's built off of statistics. So I like statistics in terms of the percentage of things, but I don't like to figure this stuff out. I do not like that kind of science math. I don't like it at all. I got a C in that class, and I was happy with that. Kept it moving. So good. You're gonna start in 22, spring of 2022. Where are you living at in terms of what school you going to, Amal? It takes stats as well along with chemistry. Oh my gosh, stats and chemistry. 20 can't come fast enough. My gosh, they set you up pretty good. They set you up pretty good for that one. But you know what? He or she must have faith and know that you could do it. So, just say you'll be done in a few weeks, or actually next week, week after next, I guess, and you can move on to better things. Because chemistry wasn't no joke for me either. I had to take two chemistry classes. Truth teller, I'm taking farm and med surg classes. Med surg again. How should I say these classes and pass? Okay, so pharmacology. Let's start with farm. Hold on, let me come back to Truth Teller. So in New York. So let me ask you this: you're not in the program yet, but I heard that by somebody on TikTok that they only allow you to make nothing less than a B in those classes. If you ever find out, let me know if that's true or not. They said in New York that if you make less than a B or a B minus in your classes, that you get kicked off the program. And this person said that was all colleges and universities in New York. It's hard to believe that that's true. So if you find out something different, let me know about that. Okay, you said no, because I was like, where's she coming from with this? But that's what she said. That all colleges and universities in New York require you to have a B or B minus at the latest. See, that's what I said. I said, okay, well maybe that's true in your program, but I mean, or in New York as a state, but that's not the standard everywhere else. We have C's here too, so okay, maybe that's the school she went to, and that's fine. But she was speaking for the whole state. Okay, so True Teller, farm. The biggest thing with farm is how I did farm and how I teach my students for farm is there's no way to know every medication. It's just not. You're not going to know every medication. So as you learn your systems, so let's say for instance, we're talking about the endocrine system. So we're talking about specifically, let's say diabetes. So first of all, knowing what diabetes is and what it does and how it impacts the body is one thing. Number two is go through your list of medications, get you a note card, some note cards, flashcards, whatever you want to do, or use Quizlet, either way, and basically kind of go through and write down what the insulins are, long acting, short acting, the class, things like that. And on one side, do that, flip it over and say what it's for. In terms of it's short acting, long acting, take it in the morning, whatever happens to be. Learn that. Learn how your medications end. LOL means what? Laws are typically your blood pressure medications. Anything that ends in, like when it comes to ampicillin, so cillins are typically your antibiotics. So be able to learn how to categorize things. So for instance, even though somebody say, let's just pretend I didn't know what gentamicin is, well, it ends in sin, so it must be an antibiotic of some sort. I can able to, in my mind, able to put it together like that. So when you have a test question on it, you can say, okay, that this is talking about a blood pressure medication, this is talking about this. What does it end in? Learn those things. That will help you. And also learn your medications in terms of what goes with what system. So um, I do OB. So for instance, in OB, we do a lot of blood pressure medications. We do a lot of magnesium sulfate, learn what they're used for. I would also learn their major side effects, and also learn their not major side effects, but they're also the more serious, deadly ones. So maybe it is not a major side effect, but it's rare, but it does happen, type of thing. Definitely find out about that in those classes. Med surge. What is it? Do you think you didn't tell me what you think you didn't get out of med surge the first time? There's something about med surge because I've heard med surge quite a few times. Miss Longford says, I'm very excited. I deal with social anxiety. I'm a little nervous. Have you guys student? Yes, I have. Yes, I have. Anxiety is no joke. I'm not even gonna lie to you. I have anxiety to a certain degree. Matter of fact, I work tomorrow and I have clinical with some LP and RN students, and I'm going to a new hospital tomorrow. And so anytime I'm going to a new hospital, we're talking about new nurses, new doctors, new environment for myself. Now I know how to teach my stuff all day long. I know my stuff, and I know my students, but we don't know the hospital. So that brings anxiety for me personally. So the one thing I have to say is that you may have, I don't know if you take any medication for it. I'm not a proponent for somebody to put somebody on medication. But if you don't take medication, find you some way to rest the night before when it comes to dealing with your anxiety. And then kind of think about what is it that makes you nervous? What specifically is making you nervous about starting? And then go to someone and ask those appropriate questions, because part of the thing with dealing with anxiety is a fear of some sort. That's basically what anxiety is. It's a fear. And so when you have a fear of something, then what is it that we're fearful of and how can we get rid of it? How can we remedy it? So maybe you have a list of questions that you need to come up with. Write down your list of questions of your what makes you anxious. And whatever it is makes you anxious, write that list down and talk to somebody that you trust about it within the program and explain to them I have a little bit of anxiety. I had students come to me because they have never been to a hospital before. They ain't never took care of a patient. They ain't never seen nobody die. They have never did any of these things, and they've come to me saying, "I don't know how to walk into this patient's room and knock and to do an assessment." And so, I said, well, you know what? Let's go in here together. Let's go in here together and let me start, and I'm gonna let you warm up to the situation and you finish it. And that worked for her. I've had other students who they had a crying session out in the bathroom. I said, well, go ahead and cry it out, get that out your system, and then come back and we'll dry your face up and we'll come back and deal with it. Deal with whatever happens to be. So you kind of just have to know what's going on with you and write your questions down. If you happen to know what it is that makes you anxious, a lot of it's the fear of the unknown, which is typical. Nursing school is no joke. It's scary. And to know that you, at the end of this, will be responsible for taking care of people and whoever, with people in general. And for a lot of people, you'll be taking care of them at their worst. So your job is to make sure that they don't die or they don't get any worse from whatever their situation may be, and that you stay safe as well. So that's that's some of the things that you can do. Just basically kind of write down and kind of identify what is it that makes me scared or nervous about this situation. Do you happen to know anything that you're okay with sharing that makes you nervous, Miss Lumsford? Anything that you know that says, you know what, this makes me nervous. What makes you kind of apprehensive? Anything specifically that makes you apprehensive? While I'm thinking, or while if she's commenting, while that's going on, I want to tell Miss Teller too, or True Teller, about when it comes to med surge specifically. Um, I know you were talking about earlier having, in terms of how to pass, but for one, know what it is that you didn't have, that you was not understanding. Was it a concept? Was it a teacher? Was it how she or he explained things? Okay, you were coming to that. Okay, let me get Miss Lunsford having to. Okay, so that what, it's just like having a conversation. Now, I will say this. Um, Unfortunately, nursing has changed from when I was a nurse. Well, when I was a nurse, I'm still a nurse. From when I first started nursing. When I say that, I mean it's changed because when I was a nurse, became a nurse, it was definitely patient centered, but it wasn't a customer service approach. So what I'm saying is now nursing is more of a customer service approach. So the same way you will walk if you happen to work somewhere else, if you worked in a restaurant, if you worked at a retail store, and you talk to them the exact same way. So it's kind of like, hey, so when I walk into a patient's room, I'll say, good morning, my name is Marita. I'll be your nurse today. I'm going to take care of you today, and Depending on usually what I'm about to do, I usually say I'm going to take your vital signs. I'm going to do your assessment. I'm going to I usually explain what the assessment means, what I'm going to look at, what I'm going to do, what I'm going to touch. I'm going to give them their medications. I kind of give them a rundown of the day so they know what to expect. The one thing I think of is how do I think about if I'm a patient? I don't want somebody coming in and out my room all day and they don't have no real purpose. So I kind of explain to my patients what we're going to be doing for the day. And if you find that you forget things, because you will, then you just come back and say, you know what, I forgot to do this earlier. I'm sorry. I just need to get this done real quick. Um, Another thing is when it comes to what to say, you're gonna have to deal with a lot of people with attitudes, a lot of people who I don't want to make any assumptions, Miss Lunsford, but um do you mind me asking what race you are? And I'll get to why in just a minute. Not trying to attack you for any reason. I'm just trying to let you know what you can expect. True telemet is hard because I always seem to answer questions wrong as far as exams. Example exams always seem to have two different right answers. Okay, you know what? So let me ask you this, True Teller. Are you okay, Miss Lunsford, I'm gonna come back to you. True Teller, do you have an NCLEX book? Do you already have an NCLEX book? Because if not, you need to get your NCLEX book like yesterday. Get on Amazon, get some money together, get on Amazon and get you an NCLEX book. Do you have one? Because that's gonna help with that real quick. So, Miss Lunsford, okay, being a minority makes it even harder. Is why I asked you that question. Being a minority makes it even harder because of the fact that we are not. They're gonna ask you. They're gonna ask you, depending on who the patient is, may ask you. Oh, could you come get that tray for me, or Could you take my trash out? And you're gonna be looking sideways. Be like, okay, I'm not dietary, nor am I uh environmental services. Not that we're above taking out trash or taking out trays, because we do that as nurses. I take out trash and I do take out trays, but that's not my primary job. So sometimes we kind of have to watch how we interact with our patients too. So I'm not saying that just because you are black, but because of the fact that we often have a bad rep in terms of not being professional. And because of our counterparts, sometimes give us, our patients may not want to deal with us in some capacity. So we have to be mindful of how we talk to them as well. So I want you to just be honest with yourself and say, okay, you know what let me think about how I talk to people. um let me make sure that we don't try to come off in a certain kind of way, and just kind of go from there, because they will take things wrong. And I've been wrote up, I won't say been wrote up, but I've been fired from patients because of the fact that um I said something along the lines of well, actually what happened was I was working night shift one day and it was 3 o'clock in the morning, and I had my hand on my hip because my back hurts. I have sciatica pain because I had a baby, and the baby sat on that nerve. And because he sat on that nerve, that nerve still hurts to this day. He's 9, but my nerve still hurts to this day. So one morning at 3 o'clock in the morning, I had my hand on my hip, not trying to be rude or ugly, but because my back was hurting. But because I had my hand on my hip, and she asked me something at 3 o'clock in the morning, I was perceived as being rude, and I was kicked out the patient's room. So that's the reason why I'm saying even how you present yourself in front of patients can sometimes get you fired, what we call fired from a patient's room. So it's very, very hard like that. Um, so you don't have truth teller. So you don't have a book. Get you an NCLEX book. Get you an NCLEX book. That's the first thing you need to do. And you can get it from Amazon. And I don't care what brand you get, just get you a book. And what you need to do is get get the book and answer questions every single day. And if it happens to be med surge and what you're taking the class, you just said med surge, so that was dumb. Okay, you're taking med surge, so go to the med surge section and every single day answer, if you can, say 25 questions a day. If you can't do 25, that's fine. Do 10 questions a day. But do the 10 questions a day and then go to the rationale and read why you had that question right or wrong. Because when you read why the question is right or wrong, you'll begin to understand how they want you to answer the question. And so when you come to which is the best answer, and a lot of times the questions are based off of nursing priorities. What is the first action the nurse needs to do? So for instance, let's say, hold on just a minute. Let me see if I can find. Hold on just a minute. London, because I have a book somewhere, so I'm gonna give you an example of a question. so that you can have an understanding, because they'll have two or three different, they'll have they'll have four answers, typically 4 to 5 answers, and you want to know which is the best. They want to know which is the best answer. What is the first priority of action or whatever it happens to be. So you may have two good answers, but let's say, for instance, um, a patient falls. I'm just give you a generic question. A patient falls, and the question says, "What do you need to do?" And let's just say one of them is call the physician, and then one of them is do an incident report. One of them is go assess the patient. All three of those is correct, because you will eventually have to notify the physician. You will have to do an incident report, but the first thing you're going to do, priority, is to go assess your patient. You can't do the other two unless you assess the patient in the first place. So I guess the thing with the NCLEX book, it will help you learn to answer which question or which answer is the best. So read the rationale, and hold on, I don't want to yell in your ear. Hold on. Come get this book for me under here for me, please. So yeah, get you a book. The NCLEX book. Look under the ottoman. Look under there. Just look under it and give me any of those books down there. It's a NCLEX book. There's two of them down there. Give me both of them. All right. So thank you. So this book right here is my NCLEX book that I'm using at the moment. This is the Lippincott one. It doesn't matter what brand you get. I just happen to pick Lippincott because Lippincott's what we use at our school. So I just kind of I got this book right here. And basically what you need to do is go through this book or a book like this and answer about 10 questions per night. At least 10, even on the weekends, even when you're out of school. So when you're out of school, do 25 questions a night. I guarantee you, once you train your brain as to how to answer the questions, the test will become easier. Now you won't know what question the teacher picks, obviously, but you'll have a better idea about how to answer the questions. So keep in mind, NCLEX doesn't want to know um, NCLEX wants to know how you think, not what you know. It wants to know how you think about a certain question, how you think about a scenario. It wants to know how you think, not what you know. So again, this is when I go back to saying earlier about how NCLEX is not about for nursing school, for ones who are just starting their nursing school. Nursing school is not about you answering a question based off of regurgitating facts. So for med surg, as an example, they're not going to ask you what is COPD, or they shouldn't be asking you what is COPD, what is diabetes, what is your parameters for this, that, and the other. They shouldn't be asking you those kind of questions, because those are knowledge-based questions. What they should be asking you is, okay, the patient has this disease process and he or she presents as such. What are we going to do about the situation? What is our first priority action for taking care of the patient? That's what the questions are going to ask you. So that's the reason why we have to be mindful of learning how to answer those questions. And that NCLEX book, books like these will help you do just that. So I have this book right here, and then a lot of you will be starting. You'll be taking your NCLEX in 2023, and 2023 is when the new NCLEX comes out. I'm not sure if it's going to be January or when, but in 2023 is when the new NCLEX comes out. And you all, if you're still in school at that point in time or taking a test at that point in time, will have the newest version of the NCLEX, which I actually take I go to a seminar at the end of this month or beginning of next month for what's going to be the new NCLEX. And you have to know your stuff. We're going to have, I feel that we're going to have a lot more students failing the NCLEX the first time because you're not ready for the new generation NCLEX Gen or Next Gen. This right here is another Lippincott, but it's called alternative format questions. And alternative format questions, why this one is good, because this is not just your standard questions. This book has in here like your select all that apply type questions. Keep in mind on NCLEX, if you have select all that apply, you have to get them all correct. So let's say, for instance, you have a select all that apply, which means you have to have at least 2 answers, obviously. If you have select all that apply, let's say, for instance, the actual answer had 3 correct answers, but you only got 2 of them. You still missed the question and there is no partial credit. So that's another thing where people tend to get those questions wrong. On NCLEX, you want to be mindful that you have to get all of them correct. Let's say you got 2 correct and 1 wrong. You selected a wrong answer. The whole thing is wrong. There is no partial credit. So you may want to also get you a book like this that is alternative format questions so that you can better basically better know how to answer different kinds of questions besides your standard multiple choice. Because you're on the new NCLEX, they're going to have um, select all and apply, a lot more of those. They're going to have what else? They're going to have the hot spots. They're going to have the drop down boxes. They're going to have all kinds of things that's going to be on the new one that is not on the old one. So it says 10, she says 10 years ago. You're welcome, True Teller. Okay, so purpose by design. Hey, how are you doing? I haven't seen you in a while. So she said she took the NCLEX to, and she had over 20 select all apply. So yeah, select all apply questions are a lot. There's a lot, and you have to have those correct. Otherwise, they're wrong. You know, she also made an interesting statement. She said she got 75 questions and the computer shut off. Um, so that means you passed. I'm taking that you passed the first time. Is that right? Because I don't want you all to get caught up in the 75 question. Oh, thank you. Thank you so much. Did you just follow me on Chris, did you just follow me on IG? Or at least you just responded on IG, I think, or you like some pictures, I think, on IG. I think you did. I think I saw your name on there. So one thing I want you to be mindful of when it comes to the what was I gonna say? When it comes to the uh shoot. Oh, questions, the 75 questions. So the computer will cut off based off of how well or how poor you're doing. Okay, yeah, because I saw you today. I think it was today I went and saw that you had like some pictures or something like that. Yes, I saw that. Thank you so much for following me over there. So I don't want y'all to get caught up in the 75 questions. You will see all these YouTubers who will say, "Oh, how to pass the test in 75 questions." That is not your goal. That is not your goal at all. Because what's end up happening is you'll have anxiety because you'll get to 75 and think, okay, it's going to cut off. Well, it could cut off because you failed the test. So don't think because you got to 75 and it cuts off that means that you done did something right. You could have failed the test. Um, so what the test does is it gives you questions based off of um, the difficulty of the test. So the more difficult questions that you have, the better you are at being prepared to take care of actual patients, basically. So if it's going to ask you a question, let's say it's an easy question. If it is hard, if it's easy and you get it right, it's going to ask you a hard question. If you get that question right, it's going to even ask you an even harder question. If you get that question right, it's going to even ask you even harder question. Get that question wrong, it's going to bring you down a notch to an easier question. And it goes back and forth like that until it determines whether you are safe, minimally safe, to take care of patients or not. Now, what I do want to tell you is keep this in mind too, because you're gonna know what I'm talking about with this. Do you all? I'm sure all have driver's license. I'm sure you all have a driver's license. So if you have a driver's license and you know what you went through to get that driver's license, the only thing they went to do was they gave you a written test or computer test or whatever, and they gave you a driving test around the block, right? Around the block, maybe on the interstate, maybe down the street, whatever happened to do, and then you had to parallel park or do something you had to do, right? They wanted to see were you minimally safe to drive and operate a vehicle. It does not mean you're an expert at it. So what that basically means, do you know people out here who don't drive well? You're like, how did they get their license, driver's license? The same thing is true in nursing. So the test only checks to see if you're minimally safe. It is not saying that that's a hard test, believe it or not, but it's still only checking to see if you're minimally safe. It's not checking to see if you are an expert at anything because you're not. All right. So Miss Renee says, how did you typically study when you were in nursing school? What was the typical day we like? Okay, so let me tell you, I've learned a lot since being an educator, Miss Renee, about how to study, and since I got my doctoral degree about how to study. In nursing school, I can't tell you I had it together because I had two little girls at the time. I had two little girls. I was a single parent. So when it comes to studying, we had study groups, and this was my nursing is my second degree. So because nursing is my second degree, I think because I had my girls and I knew I had to get my life in order for them, single parent, and my first degree was not going to pan out in terms of taking care of my girls. So I basically had to find a way in which I was had to be serious. I was dead serious about this program. And then of course I'm taking care of people and I want to learn how to do it and do it effectively. So when it came to studying, we formed study groups, kind of like I was telling you all earlier, when y'all said you had a group meet and things like that. We formed study groups. I kind of linked up with a lot of the other single moms, or maybe not single moms, but the other moms. Because the thing is, we had something in common. We know what it's like to have the struggle of having small kids that when they get sick and we had to get up and we had to do this for them and do that for them and get things ready the night before. We just had a common understanding that our single nursing student, or not when I say single, our students with no children didn't have to go through. So I kind of linked up with them. That was first and foremost. And when it came to studying, we studied every single week, if not every other week, if every other week, if not every week, depending on when the test was. And what we did was once we got our group together, that we trust, mind you, that we trust, we would rotate houses. I lived in an apartment at the time. We would rotate houses. And so when we rotated houses, that meant that we all brought our kids to whoever's house it happens to be because we all had kids. Because, finding childcare is hard, especially after childcare hours, after school. So we would go to each other's house, and that means that person who hosts that day, she would prepare like snacks for the kids or prepare a dinner, spaghetti, something that's going, something that's easy to make and something that's going to fill us all up and fill the kids up. And we sat there and studied. And then they have a play area for the kids, and that's what we did. So we rotated houses doing that same thing my whole nursing school career, because that's what we had to do. We were determined to make it. We was going to make it by any means necessary. When I did not have my study group, when I tell you I studied every single day, I studied every single day to the point of that my advisor told me I needed to go out one night because I was so stressed. I was so stressed. I went to the movies one time that whole 2 years, and that's because she told me I needed to go out. She said because you're doing too much, you're overstudying. Overstudying can be a bad thing too because you won't retain it, you won't remember it. So the biggest thing I did was making sure that I had my kids organized in terms of their backpacks were ready. They were in preschool, I think, at the time. Have their backpacks ready, have their food ready, snacks ready. They have cereal or oatmeal the next morning for breakfast. I had whatever it was ready, clothes ironed for the entire week. That's hard to do, but I had it done. Two girls, clothes ironed for the entire week. I would, wash their hair on Sundays, plait it up real small or get it braided so I ain't gotta worry about hair for the rest of the week. And that's what I did. You don't have a little girl, so you don't have to worry about that. But take them get their haircuts once a week or every 2 weeks or whatever. When I was, let's say for instance, I took my books everywhere I went. So I had kids who had doctor's appointments. You know how you always waiting somewhere for something. So if you waiting in line for something, get your book out. Have your book with you. I was standing in line reading my book. I did that even my doctoral program. I stand in line. I was waiting that I needed a good spot for seats for something I was doing for my son. And I had my book with me in my purse. I got my book out and started highlighting and reading while standing in line. As the line moved up, I'm steadily reading. I always took my books with me wherever I went. Had a doctor's appointment, guess what I did? Took my books with me. Um, if we had where I live at, sometimes we have bad traffic or we have accidents on the interstate or it shuts the interstate down for an hour. As an example, guess what I had? My books. So I'm like, okay, we're gonna be sitting here for an hour anyway. Roll down the windows, turn the car off because we're gonna be sitting here. I studied, I read. I always, always, always had my books with me. Is what I did. Flashcards, yes, that's a great advice. Flashcards, and nowadays you all have Quizlet. You have different things online that you can do, or on your phone that you can do. We didn't have that back then, 2004. We didn't have nothing like that. Flashcards we can always create. So create flashcards for things that you really don't understand. Um, hey Marissa, how are you doing today or tonight? How's things going? So just do those kind of things. It was very hard, Miss Renee, to keep in mind in nursing school I think for our program we had one day off. We had class 4 days a week, and then um we had one day off per week. That one day off I still sent the kids to daycare, and I still studied all day long, and whatever test I had coming up is what I had to study for. One thing you need to do is make sure you are organized. Get you a planner, a real planner, not your phone. I don't even know what my planner is right now. But get you a real planner, not your phone, not just your phone. Um, uh, your phone is great, but the problem with your phone is if something happens with the battery die or something happens where we had a situation here in Tennessee where for on Christmas Day, um, somebody bombed somebody bombed downtown Nashville, and as a result, all the AT&T towers went off, and nobody with AT&T phones had service. Nobody had service who had AT&T. So that I don't have AT&T, I have Verizon, but that taught me right then and there. Make sure that so people who had calendars on their phone, they had no idea what they were doing for days. No idea. Do not rely on technology because it will fail you. We need to go back to the old method of either using this and your planner, your actual paper planner, um, your actual paper planner, or something like that. You have to have something like that. So get your planner and write things down. Oh, thank you. My son is helpful tonight. This is my little my helpmate. He brought me my planner. My planner. Everything. If it don't go in here, it ain't happening. So anybody who anybody knows me will say, did you put it in your planner? I said, oh, okay, let me put it in there. Let me put it in. Because if it don't go in here, it is not happening. I don't even use my phone for planning anything. Get you one of these and organize yourself. When your syllabus come out next month, when you get your syllabus, get all of them together. You sit down and you write all your assignments and when they're due. Write down everything when they're due so that keeps you on track throughout the whole semester in your actual planner, not your phone. Get you one of those. That will help keep you straight much better than your phone will, because your phone needs to be something that's really separate from you, because you'll use it as a distraction. You'll Next thing you know, you're on YouTube watching videos about nothing, or you're on IG or doing something you're not supposed to do when you need to be studying or something like that. So get you stuff like that. Get you highlighters and get you the things that you like. If you like stationery, because that's your thing, that's my thing too. I like stationery. But if you like stationery, highlighters, pens, do anything you need to do to kind of keep you motivated and keep you going. So maybe um, you start school next month, maybe at the end of this month or whenever you get paid again or have a little extra money, go to Marshall's or go to TJ Maxx if you have one, or go somewhere like that and go get you some cute stuff. It helps keeps you mentally motivated. Like, okay, I like my little highlighters, I like my pens, I like my whatever. Set you up a little study area in your house or your apartment. Set you up an area in which this is my study area. That is away from TV, or cut your TV off so that you can focus on that. You have to be in the mindset to be prepared for nursing school, and then of course still with your children too. And so that will help you out as well. Oh, good, Marissa. You off for 6 days? That's good. What you gonna do when your 6 days off? You gonna go shopping, or what you gonna do? What you gonna do on your days off? You're welcome, Miss Renee. What you gonna do on your days off? I just got back from vacation from the beach, and it was great. And I start back work August 6th, so I only got about 2 weeks left before I start working again. 2 or 3 weeks before I start working again. Um, yeah, 3 weeks before I start working again. So I'm gonna enjoy my last 3 weeks off before I go back to work. And then I'm gonna be just as busy as you all, but from the other side. Just as busy, but from the other side. So what else is going on, everybody? It's been great talking to everybody. Let me ask you all this while you're still on here, because I'll be back next Friday, same time, 6 o'clock, 6 o'clock Central Standard Time. My question is, would you rather keep this format where it's just we just talk, or do you want me to have a topic in mind, and then after that we talk and ask questions? So just kind of, and I'll put that on the community tab as well. Which one you all would like to do, or we can mix it up. I can have topics in mind, and then after that we can go into questions and answers, or we can just do it like we've been doing it. Yes, Miss Lunsford, set up your study area. That will help you. Okay. Amal says both. Okay, we'll do that. We can do that. I'll have topics in mind next time. And then we can ask questions or whatever. Because I honestly think, you're not going to get the same. All your instructors do not teach the same. And that's just how it is. There's no per se rule in terms of, we have a lot of autonomy. And it was called academic freedom to teach how we teach. And a lot of us are teaching based off how we were taught. Some of us were not taught well. And I'm finding out now that I'm a full-time educator, that there's a lot of things in nursing school that I never got. And unfortunately, I think it would have been great to know some things that I don't know today. I mean, that I do know today back then, so I could appreciate even more the strives that people have done, to pave the way for us to be nurses, for everybody to be nurses. So I'll definitely do that, because I just feel like we're not all being taught the same. Or if nothing else, it could be where um, your instructor explains it one way, but you just don't get it that way. So maybe I can explain it a different way for you, or whatever it happens to be. Okay, the hardest part about nursing school, in your opinion? In my opinion, as a student. So when I was a student, the hardest part of nursing school was really to acclimate to the um acclimate to the what's the word I'm looking for? The structure of nursing school. Again, when I was saying at the very beginning how it's not like your general education classes are, you're thinking, okay, well, I'm gonna come in here. I made straight A's in English and all these other classes I took. I made straight A's, history, whatever, whatever. Okay, nursing school ain't nothing like that. It's the hardest thing you ever did. And then you are also, we're talking about a professional program here. So we're not talking about can you tell me what A, B, and C is. It's gonna take you to a whole different level of thinking. And that level of thinking is what is the challenge. That plus the physical demands of being where you need to be every single day on time. You have class 4 days a week, all day, every day. You have clinicals that are 12 hours here. They want to make sure that you have to wear your uniform a certain way, look a certain way. You can't have, like, I have this piercing right here. This piercing right here. I can't have this in nursing school. So like I go clinical tomorrow and I have to take this out right here. So you have to dress a certain way. Your hair can't be a certain way. You can't wear too much makeup. It has to be, and every program is different, obviously. So it's not even just the mental part of it, it's the physical part of it as well. And then you have different instructors. So different instructors have different expectations. And it's very easy as a student to say, well, why can't they all be on the same accord? Well, because they're not. Just like your English teacher and your math teacher don't teach the same because they're two different people. So, yes, the workload is very, very hard, and there's a lot of information to learn. And let's say, for instance, I can recall. Well, I'm speaking now more so because of my students before, besides myself. Because back when I was in school, they expected you to read everything. So if they said read chapters 1 through 10, you read chapters 1 through 10, and I'm telling you to do the same. If they tell you to read chapters 1 through 10 by, let's say today is what, Friday. If they say read chapters 1 through 10 by Monday, you best to believe you better read chapters 1 through 10 by Monday. Now, does that mean all that's going to be on the test? No, but you're not studying just to take a test. You're studying to take care of people and making sure that they don't get any worse than what they already are. You want to bring them back to the baseline at minimum. Bring them back to their baseline at minimum, or make sure they don't get any worse than what they already were when you touched them. So I would say the mental mindset. I would say the rigor, the workload, like she said, the responsibilities, the expectations. A lot of programs will not coddle you, meaning they're not going to hold your hand. They're not going to say, okay, this, that, and the other, or they're not going to be as empathetic as you think they should be, because it is a professional program. I've never been in the military before, but I can tell you it's kind of like a boot camp at the beginning. They're gonna whip you into shape. They're gonna whip you into shape real quick. And after that first semester come and go, hopefully you're successful that first semester, because a lot of times we lose. Just this past semester, this is what, spring semester, which just passed. Students didn't believe how hard it was. We only had 10 students to begin with. 10 students to begin with that started this past spring. Three of them quit the first 3 weeks of the program, of their first semester. Three quit within the first 3 weeks because it's not what you think it is. It's just not. And it's not for everyone. That's a good point that you make. Purposeful by design. It's not for everyone. And truth be told, let's be honest right here. Do you really want everybody being nurses just because they want to be? Do you want people being nurses that just because they want to be, and they are not meant, they're not capable? Yeah, there you go. You already ready for it. Then you're not gonna have a life. Nope. Life as you knew it. Who are your friends? You don't know them no more. And maybe that'd be a good way of that's the sacrifice. If having no life means what it means, that's the sacrifice. But you will be able to have your life back after school is over. So just be mindful. It's not forever. It's the next few years, but it's not forever. But the thing is, what you want to obtain is more important than having a life, as you say. So again, I only went to one movie in 2 years. One movie in 2 years, because it was my life, like you said. And I tell my students all the time, you have to want to, not literally when I say this, but you have to want to die for this. Not literally die. Not, I don't mean like literally die, but you literally want to, you want this so bad that you will almost die for it. That's how serious it has to be. So when they ask you about going to that game or going to this event the night before an exam, that maybe it have to be a hard no. Like, no, I can't go. I got to study. I got to test tomorrow. I got to test tomorrow. I lost out on a lot of events, and probably lost a lot of friends as a result too. But you know what? That's okay. They weren't meant to be on this part of the journey with me. That's okay. Yep, you came out of hibernation. Yes, and you have to yeah, and hopefully they still there waiting on you, and you will see too, Mister Is it Cotterell? Is that how you say your name? I don't want to mispronounce your name. But the one thing you will find that when you go through this program, you're going to mature a lot. And I'm not saying you're immature now. I'm not saying that at all. I'm saying this program will teach you so much about yourself, like personally. It will teach you more about yourself. It will teach you more about what you can endure. When you didn't think you could do something, how you made it. Cotterell. Okay. Thank you. Thank you. I needed that. Thank you, Cotterell. Mr. Cotterell. Um, it will make you realize how you it'll make you realize how you've grown so much as a person, and you begin to look back at some of your so-called, when I say so-called, but so-called friends, and you'll be like, dang, I used to act like that. I used to hang with people like that. You will mature in this program too, because you've been forced to, because you have to look at things from a different perspective. You will have seen things, heard things, learned about things that your friends don't wouldn't even fathom. There's things that I have seen in nursing that I'm like, I have never seen anything like that. Like I remember as a nursing student, and this is too much information, but this is how nursing school was for us. So hold on just a minute. London, need you to go out the room for a minute. So when I was in nursing school, we did our ER rotation. I need you to go too. I need you to go. I'm not, I'm my kids are in the room. So anyway, they I was in my ER rotation, and me and my partner, we were partnered up in the ER. And what happened was we had a homeless patient come in. She was a homeless patient, and it was wintertime, so of course she was claiming that she was having chest pain. That is their number one way of getting into the ER and getting a bed in the hospitals, by saying they have chest pain, because they know they're gonna get a bed, and they're gonna get a meal, because you cannot turn patients away. So anyway, when she came in smelling very, very bad, very bad. And of course, as the nursing students, what did they have us do? They had us clean her up. And so when we had to clean her up, and she smelled like, feces and urine and stuff like that, just smelled very bad. And she looked like she was probably about, if I looked at her, maybe like in her 50s. But once we got all the dirt and stuff off of her, so when we had to go clean her up in her vaginal area, clean her up down there, because of course, all the smell and odor, stuff like that. When we cleaned her up, no lie, me and the student was cleaning down there, trying, and we use shaving cream. So that you take a regular, like, was it, I don't know, whatever shaving cream that men use, that's the foam kind. You spray all that stuff down there, and it will have you just as clean down there. That's what they used back then, shaving cream. Don't you all know that once we finished down there and got her kind of clean, that maggots came out from down there? And when them maggots came out from down there, and me and my partner, we didn't have no poker faces back then because we was in nursing school. We flew out of there so fast, and that's a big no-no. You don't leave your patient, and that was probably embarrassing for her, and that was not good for us. But when that happened, um, I have never seen maggots come out of any woman's area, and I haven't seen it since because I'm an OB nurse. But I have seen some things in my life that yes, 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 all that, yes. Um, so, if you know what maggots are and how they become that way, flies laying these eggs in somebody, she is homeless. So it's nasty to us. I know it is, because we have access to water, and we can wash, and we can do what we need to do. But when you are on the streets and you're homeless, and people are like, oh, and then by the way, we found out she was pregnant too. So, women still do what they do. We still do what we do, even if we on the streets, because she was pregnant. We found out she was pregnant after the fact, when we did a urine drug test, and found out she was pregnant too. But yeah, so if you laying on the ground all the time, it's no tunnel could crawl up in there, type of thing. So when I say to you, Mr. Cotterell, that how it's going to change you, you're going to see some things that you have never seen, but your friends is living the life that they've been living this whole time. You're like, dang, I've seen some things that, like, it makes you grateful for what you have. I've seen some things in my 17 years as a nurse, and I've seen everything from, I had a psychotic patient. I had, the one I just told you about in nursing school. I'll tell you a story, another story about, I had a patient when I was on my mental health rotation, which is why I don't do mental health now, because I mentally cannot handle it. I had a patient who, um, in nursing school, you'll be taught to use what's called therapeutic. What is it called? Therapeutic communication. I think it's called therapeutic communication in nursing school. And as an example, you may have somebody who's mentally ill, and they may say something like, well, I'll just tell you my story. The guy said something like, it was a black guy who, it was me and my partner. We were always partnered up in my program, always partnered up, especially for like situations like that. So we went to a mental institution. It was actually called the Insane Asylum. So if you, I'm gonna put this in the chat box. If you all have time, one day look up Western State University. I mean, not university, Western State Hospital. Western State Hospital. And it's in Hopkinsville, Kentucky. So one day look that up and look for old pictures. Look up Insane Asylum, and you will see what this place looks like. And that's where I went to for my mental health rotation. They sent us to this insane asylum, what they used to call, in mental institutions today, called insane asylums back in the day. Look that up one day and look at the old pictures of is in Hopkinsville, Kentucky. It's in Kentucky. So find the one that's in Kentucky. And so anyway, we went there and they had me and my partner. I don't want to call her name in case she ever sees this in the future. But my partner, we were together. We walk into the chronic unit. The chronic unit is the unit that they live there. They're not acute. They're not having a crisis today and be gone next week. These people live at this place. And what ended up happening was, first day I hear them doors locked behind me. That scared me to death. And just like how dogs can read you, mentally ill people can read you too. They know when you're scared of them. They're very smart people, to be honest with you. Where they lack up here with whatever kind of mental illness they have, they are very smart otherwise. And this man walks up to me, my partner standing by my side. Me and her was like white on rice. We didn't leave each other. If she had to go to the bathroom, I had to go to the bathroom, and that's what we did the whole time we did that rotation. This man comes up to me and he gets in my 3 feet personal space, right? And he says to me, "Does your father know what we did last night?" And me, I'm like, I clutch my proverbial pearls because I'm like, oh my gosh, like who talks like that to somebody? And here I am trying to use my therapeutic communication that they taught us in school. And I said, well, I know that you may think we were together last night, but I don't know you. We weren't together last night. Don't you know that man got closer in my face, nose to nose, and said, don't you know what we did last night? Or don't your dad know what we did last night? And at that point in time, I was with whatever he said we did last night is what we did last night because I needed him out of my face. And that scared me to death. So when I tell you I have been through some things in nursing school, and me and my partner, we got up out of there out of that area so quick. I went and told the nurses. I said, I said, he said this, that, and the other to me. And then the nurses told us, don't be flattered because he talks like that to everybody. I was not flattered. I was scared for my life at that point in time because I've never endured anything like that before. Never. So when I tell you you're gonna have some experiences in school, and hopefully your program will keep you more, relatively safe. That's not the worst story there. I've had other even worse stories there. By the time I finished that rotation, my mental health rotation, by the time I finished the rotation, I had to go get on blood pressure medication and anxiety medication. That's what that rotation did to me. Yes, yes, yes. You pretty much. I'm glad you like it. I'm glad you love mental health because them people crazy. Now, hopefully, them people really crazy. Now, mind you, mental health is not just the whole psych part of it. I do mental health too in OB because mental health is everywhere. You won't believe how much depression that we have. I had my first psychotic patient probably about a year and a half ago. My first psychotic patient, actively psychotic. She had schizophrenia and she was actively psychotic. And she told me that she saw horns come out the baby's head. I mean, that's how crazy. So I still do the craziness, but I'm better apt to deal with it today because I have more experience than I was in nursing school. So I was just trying to tell Mr. Cotterell that you're gonna have some experiences that your friends don't have, and it's gonna humble you and it's going to mature you too. So that's why you catch me. Okay, but the thing is, I'm just trying to tell you that's where I saw these people. I saw the one who was psychotic in OB. They have babies too. Crazy people have babies. You can see them there too. So the thing about OB is you're gonna see the crazy ones there because I didn't have them. I've actually taken care of the forensic population. So what I mean by that is, um, what I mean by that is I take care of a lot of drug moms. People don't take drugs because they no, okay. I take that back. Some people do start off taking drugs for something just to do, or to because they've been what's the word I'm looking for? They've been peer pressure or something like that. But people stay on those things because they are coping with something else. A lot of times these women have other issues going on. So even in OB, we deal with moms, just like Purposely Designed said, we have moms who have been abused, drug addicted. I mean, I have plenty of, I live in Tennessee. Like I told y'all last week, I live in Tennessee, and Tennessee ranks number 3 on prescriptions. Or at least it did in 2019, it did. Uh, Number 3 in prescriptions and number 4 in overdoses. We rank number 4 in overdoses. That's not good because of the fact that that's what we see. So it's not, I have to call DCS all the time. I call DCS all the time because somebody's positive for some kind of, some type of drug. Even though I'm a new nurse, I've seen few months. Yeah, positive for drugs. Yeah. And where do you stay at? Where do you live at, Marissa? Or in terms of what state? So, I've worked inpatient line is my the building. Some committed suicide. Yes. So you them okay. Now I don't know if y'all see we get into a whole nother topic. I don't know if anybody's spiritual or not. Let me tell you about the stuff that goes on, even in the hospitals that happens. When someone passes one way or the other, whether it happens naturally or they do it themselves, I'm telling you, sometimes those souls are trying to escape and or they don't escape. I don't know what they do. I don't know what happens to them, but those souls get trapped sometimes because we even have that at the hospital. We had this one room in the hospital that the call bell kept going off, and there is nobody in that. We didn't have anybody in that room, and it ended up that the person who is in the hospital on the OB floor, mind you, the person on the same the we were on floor 3, so the second floor beneath us was ICU, and the room beneath us in ICU, directly under our room, someone had passed in that room and had been calling the call light even down there. So our call light was going off like it was just kind of it was just crazy. When I tell you something creepy, we have seen some things in the hospital. I'm telling you, souls are trying to escape sometimes. And they need that's the reason why the old folks used to say they'll open a window, and we can't open the window in the hospital. At least not our hospital. We can't open windows for obvious reasons. But that's why they would open the windows back in the days because they would let that soul go out, so that if they were dying, it would let the soul escape, so it would be stuck in this world. It would be able to transition. And so yeah, it's bad. It's really really bad. Inpatient. Um, Hernandez. Okay, Jacqueline. So one of my best, most rewarding memories in nursing. Let's see. This may not sound good. This may not sound good, and I have to give you a story time. Actually, I put this story on another video, and if you come back next week, I can tell you the story because it's a long story. But one of my most rewarding days was when I was able to save this woman. Um, because she was I okay. So I'm gonna give you a run of the story real quick. Um, I was down staffed one day, which basically means that they had called me off. They didn't need me. They called me off, and they had this is November 11th of 2019. That's how bad that day was. This is how bad the day was. I remember the date. They had called me off, said I didn't have to work, but then the nurse texted me and said she didn't feel good. Could I come in and replace her? And I was dragging my feet to get there because I'm like, hey, you know what? You should have just called out to begin with because I don't like coming in to work late in the shift because I feel like you're discombobulated the entire shift once you get there. I just assumed I had to come in from the very beginning, but that's neither here nor there. Anyway, I get to the hospital and that nurse only has one patient, but there's 6 patients on the floor. That told me that one patient was very sick because we don't do that. I don't care how sick the nurse was, she would have got her fair load. So she only had that one patient. The story behind the patient was that she was having her heart rate was up. She about 170 was her heart rate. That's not normal for nobody. I said heart rate of 170. She had a C-section the previous day about 4 o'clock in the afternoon, so that would have been the 10th at 4 o'clock in the afternoon. And anyway, she had a heart rate going up, and she was looking gray. Well, you know what? I don't know everything about sepsis and all this other stuff, so I don't know what all that looks like. Why? Because I don't do all that in nursing. That's not what OB is like. Fast forward, the doctor comes in that morning. The night shift said, we wanted to call rapid response, but we chose not to. Now, why would you do that? I don't know. Why would you say you want to call a response and not do it? Your gut tell you to do something, you better do it. Yes, 170. So when I ended up basically um getting her, and I something told me to go ahead and do a whole assessment. Now the nurse just did the assessment at 8 o'clock in the morning, right? Typically, when we change over like that in the middle of a shift, I don't do a whole head to toe assessment. I will just pick up where she left off because the whole head to toe is not necessary. I may do a focus assessment. I may feel her fundus or something like that, but I may not do a whole assessment. Something said do a whole head to toe assessment. When I did her whole head to toe assessment, her abdomen was rigid, and it was not how it's supposed to be when you have a baby. Also, I noticed she had no bleeding down there at all. No bleeding after having a baby. That's not heard of. That's the two times we bleed is, as you know, on a cycle or once we have a baby. And those are the two normal times that you will bleed too. So she had no bleeding all down there. So I'm like, where is blood going? Nothing. Turned her over. Nothing. 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 Right. Blood pressure was fine. Heart rate was still in about 140s at this point in time. It came down. And I'm gonna kind of skip through the story, but basically gave her all this blood and everything like that. Her heart rate, once her heart rate started coming down, she started looking better because we was giving her blood. But then next thing I know, her heart rate jumps back up. And when I do her H&H after the blood transfusion, I noticed the H&H come down. They didn't go up, they went down. I said, you know what? I'm not gonna play tag all day with this. I'm gonna go ahead and call rapid response. When I went to push that button to call the rapid response, the manager came down the hall and pushed the button. You know how you have a phone and you touch that one part to disconnect the call, so you can still be holding it, but you just touch that one part. The manager touched that one part to disconnect the call when I was about to make a rapid response. I said, you know what? That's gonna go on you right there. I'm about to document everything that you just did because I said this patient right here needs to get off this floor. She needs to get off the floor now. We have been trying to babysit this woman for I don't know how long, and she's not doing well. She needs more higher level care than we can provide here. Anyway, I do everything I need to do. I call the doctor and I said, listen, either you get her off the floor today, right now, or you can find her in the floor. Yes, ICU was needed. That's where I end up. Well, she gets there eventually. I said, you either get her off the floor today, or you will see her in the morgue tomorrow. That's what I told the doctor, and I hung up on the phone on him because he had hung up on me several times. And because I was serious at that point. If I tell you to come see your patient, that's what I mean. And I mean you come now. When I call, I mean you come. And he was just upset with me because he's like, well, she was fine when I left. I said she was gray as the wall when you left. She was not, and gray is not a color that anybody should look like. She was Caucasian and she was gray. She should not look like gray. No one should look the color gray. It was just that bad. She looked like the back this, not this color gray, a lighter shade of this, what she looked like. And I'm kind of like that. Don't nobody look like that. And so fast forward, by the end of my shift, I had sent her. I had called and I had got her to. Once I did that, he took me seriously. So he said I could take her to step down. He said I could take her to step down. I said okay, fine, just get her off my floor. So I take her to step down, and this is about 4 something in the afternoon. And so now it's 24 hours since she's had the baby at this point in time. One thing we're not allowed to do, as you all know, is give false hope. Her mother was saying to me, she said she's going to be okay. And she said she's going to be just fine. She was going to die that night. If I hadn't got off the floor, honestly, I was like, she was going to die. She's just not on me. She's going to die. But I could not tell the grandmother that. You can't. That's something we shouldn't do. But I did do it. I said no. She's not going to die. She's going to be fine. And her mother cried. The grandmother to the baby cried, and I'm like, okay, what? I felt so bad. I didn't know what to say. And basically, after all that was said and done, we got her to the floor. I took her down. The nurse who caught her, her name was her. Well, I can't say her name. Never mind. But anyway, she was a fiery redhead. She had red hair, blue eyes, and she was tall. And so she says, when I was bringing her down the unit from for step down, they said, "Is she dead?" I said, "I would be bringing her here if she was dead." But that's how bad she looked. They was asking me what she did. I said, "That's how bad she looked." She was. She wasn't dead, but she was dying. She had already started that. What is it called when you are dying and your legs start like? Is it called molting? Is that the word? Because I don't do hospice or nothing like that. Is that the word? Molting, malting, whatever that word is. I'm trying to say. She had already started doing that. Stuff was shutting down. And anyway, she said, "Oh, I can't do this. This is what the nurse said. I can't do this." She said, "No, no, no." She looked like she about to die. She said, "I have a 1-to-4 ratio. I need to call rapid response." I said, "I've been trying to do that all day." And so anyway, what ends up happening was, um, by the time my shift was over, it's 4 something in the afternoon. By the time my shift was over, she had called the physician again and said, "You get her off this floor and get her to ICU." So she gets to ICU by 9 o'clock that night. When they go do an ultrasound or a CT scan, it was ultrasound. The CT scan, not CT, MRI. They did something, and they looked at her abdomen. She had a clot in her abdomen that was big as a loaf of bread. So about what, that long? A clot in her abdomen, about a loaf of bread size, and she had 1,500 mLs of blood in her abdomen. That's why her stomach was rigid. That's why she was about to come off that table. So to answer your question, and she also was withdrawing from drugs. That's another whole story. She was withdrawing from drugs, so she was throwing up and doing all kinds of things that she shouldn't have been doing because of the drugs. Ain't nobody talking about the drug problem that she had. And I'm kind of like, okay, she's withdrawing from something. She's on fire. She says she's on fire. When the patient tell you I'm on fire, they withdrawing from something and start sweating profusely. That's when I learned about withdrawals very well. Anyway, she had that clot in her stomach. She had all that blood in her stomach. They had to go back in through her incision where her C-section was and clean her out again, right? Fast forward from that, guess what? She didn't have her I don't know, methadone, I think it was. We didn't have it. We didn't have her dose of methadone. So she didn't have her methadone. So guess what? When you're withdrawing, you're also throwing up. So she threw up so much she dehissed, opened herself back up again in terms of by throwing up. So that lady was in the NICU, I mean not NICU, ICU for a whole week because of the fact that the nurses prior to me did not do their job. So to answer your question, that was one of the most, it was the most saddest things that happened to me, but it was the most rewarding because of the fact that she would have died that night if I had not called, if I had not got serious. Now I never called the rapid response per se because they hung up the phone on the manager hung up the phone so I wouldn't make the call go through. But I had to get serious with the doctor, let him know I'm not playing with you. Either you come see her right now or transfer off this unit right now, or you will find her in the morgue find her in the morgue tomorrow. I said, it's up to you. And I hung up the phone. Because I'm not playing that. And then after that, I was going to call the rapid response, but he called right back and said, okay, get her transferred to step down. Which anyway, she ends up in ICU anyway. And until this day, I think she's still alive. At least from that situation, she's still alive. But that was rewarding because of the fact that even though I did not know what was wrong with her, it felt great to know that I had enough of an assessment skill and base on me that I knew that I I figured it out. I figured it out. I didn't know what was wrong, but I knew how to help her. I knew she needed to go somewhere. I knew that when her H&H went down and not up, that's a problem. Well, I knew when I checked her pad down there was no blood on it. Okay, where's the blood going? Where's it going? I knew I had enough assessment skills and critical thinking skills to think through that process and say something is not right with this woman right here. And because I did that, and because of the fact this Lasix is not working because she wasn't putting out any fluid at all, her Lasix was not working. Her, what is y'all doing? What was y'all doing last night? Y'all sat here and thought y'all was going to call rapid response and didn't. So that whole shift got rolled up the previous night because of the fact that they delayed her care. They delayed her care. So if I hadn't have came in that day because the other nurse was sick, mind you, if I hadn't come in today that day, she could have died. She could have died. So for me, it was wonderful to actually thank God that she didn't die and that I could actually tell her mom the truth. Well, it wasn't the truth at the time, but they ended up being the truth that the patient was going to live and be fine. Um, but it's kind of like your intuition. It's like something ain't right. You know it ain't right, but you can't figure out what's wrong. But that was my most rewarding situation. That was like 2 years ago that it happened, and I will never forget that story. I remember it like it was yesterday. What's the one I gave birth to? Was the first time I seen the doctor. There's nothing. Yeah, that's pretty much true. The nurses do everything. That's the reason why it kills me when people say that oh my doctor this, my doctor. If you knew what as nurses go through for you to even know that your doctor really don't even care about you, these doctors, not all of them, but some of them. Okay, once they get their money from you, once you have delivered that baby, once you deliver that baby, they are really done with you. They have did all they're supposed to do. That postpartum care, when I call a doctor and say my patient's blood pressure is 150 something or whatever, they're like, go ahead, send her home. They don't want to deal with you no more. They didn't got their money. They done. So again, that's the reason I said, it's not the doctors, it's the nurses. We the MVPs for sure. I don't know why they do either. I think a lot of it has to do with the fact that the doctors have a complex, if you will. And the other part of it is they have the superiority complex. They know everything. You don't know everything. And they have learned enough about me over 15 years that when I call you, I'm calling you for a reason. When I call and give you my S bar, that recommendation is what I mean that we need to do. We need to do this, this, and this. Is that what you want? And a lot of people are like, yeah, that's what we want to do. Whatever you want to do. I said, you want me to call you back with an H and H? Do you want me to do this? You want me to do that? Yeah, that's what we want to do. Do you want me to go ahead and send her down? Do you want me to do this? I already have my list of things I want you to do. I just need you to give me the order, do it. And when they begin to trust you, then they're like, okay, well, we trust her, so we understand, or we know that she's going to do right for her patient. So you have to have really good assessment skills and critical thinking skills, which I have. Um, let's see, multiple assessments during shift are so important. Yes, they are. I guess in my mind just felt like, well, how we typically do things on our floor is the fact that once you come in, the morning nurse does the we only do assessments once a shift. We only do a head to toe once a shift. We do focused assessments every 4 hours. But something said to me to do a head to toe because a focused assessment in OB is just the fundus and bleeding and stuff like that. That's a focused assessment in bleeding. The bubble her type thing, bubble heave, whatever type thing. That's what we do in OB in terms of focused assessment. But a whole head to toe, we don't do but once a shift. But something told me that day, I don't care, it's 11 o'clock in the morning still. She just did an assessment 3 hours prior. I still did another whole head to toe assessment. And that's what made me find we didn't really trying to feel to see if your stomach rigid, but when I went to listen to her bowel sounds on her quadrants and just to place that diaphragm on her belly and she did the exorcist on me coming up off that bed, I knew something was wrong with that belly. So that's kind of how, I knew with her. Do you know of any places or hospitals that still pay for you to continue education or further your nursing degree? Oh yeah, there's plenty of. You have to do your research. There's plenty of hospitals that will do that. They have those programs where they will do tuition reimbursement, and there's a lot of hospitals that will also do. There's a lot of hospitals who will do sign-on bonuses. Now, I will say the thing about a sign-on bonus is if they're offering you a sign-on bonus, it's because of the fact that there's a problem with that hospital. So when you start seeing these $10,000 sign-on bonuses, you best to believe that hospital's not a good hospital because they got to pay you to get if they have to pay you to come and get a wage that you was already gonna get, that tells you what a good hospital. So yeah, there's plenty of hospitals that you can get the money one way or the other. So get the money by either getting a sign-on bonus and save it and pay for school, or simply do your tuition reimbursement. That most hospitals will pay for tuition reimbursement. So you basically pay for your class and then they'll reimburse you the money. So there's a lot of hospitals that do that. Now, if there's a hospital who's pushing for magnet status and you're already there, sometimes they will help push you to. I agree. Don't take the bonus. I'm just saying if you do take it, some people do take it, they will push you to go to the next level. So if that's your situation, you get pushed to go to the next level, then uh definitely do that. They will pay for it. Let them pay for whatever they want to pay for. Not a problem. Yeah, almost all Erie Hospital does that. So yeah, they do. And no, I agree. Don't take the bonus, but there's some people who are like, oh, they offer me $10,000 bonus. I said, how many years of your life do you have to give to them for $10,000? Oh, just eight. I'm like 8 years for 10. Oh, it ain't even worth it. They can have their 10,000 back. So if you do take the sign-on bonus, if you either have a way to pay it back or be miserable for the next 8 years. I just tell people either have a way to pay it back or just be miserable. Because I learned, and that's another story for another day. I'll tell you about that another day. But I had a sign-on bonus. It was only for 4,000, and back then 4,000 was a lot of money. But anyway, and I learned my lesson from that, and I have never taken out a sign-on bonus ever again. So if you're gonna do it, hold on to the money or have a way of paying it back. Yes, know what you're signing up for in the time frame. Because sometimes they say, well, you can get $10,000 for 2 years. Well, 2 years ain't that bad, but 10,000 for eight, nah, you can keep it. You can keep it. Right. You do have to give it back. And sometimes, guess what? Let's just say you did 2 years, 3, 4 years. They make you pay the whole thing back sometimes, even if you don't, even if like a lot of times as you work, you kind of pay off some of your time. But some hospitals will say you got to pay the whole thing back. They not, they like you don't. We want the whole 10,000 back. So you got to read the fine print on that contract because they don't play about that sometimes. All right, well, this has been great, y'all. I am loving these lives every Friday. So not every Friday. It's not gonna be every Friday for the next 3 weeks because I have to work the next 3 weekends at my other job. So the next 3 Fridays I'll be here about 6 o'clock. But I keep in mind on the community tab, and I'll put that in there for you about what time I'm gonna come. But I'm about to head off today. I really enjoy you all. Like I said, someone said earlier that they wanted to actually have like a topic and then we actually have discussion questions. So if you all don't mind, you don't do it right this minute, but if this is going to be on the replay, if you don't mind either putting in there on the community tab, either one, what topics do you want us to discuss specifically? And then we will still have question and answer after the fact, have a discussion after the fact. So that way we can kind of tailor what we want to do for future lives. So like I'll be going live every week as long as my schedule allows. I do start school on when I say I start school, I mean I start teaching. Um, I don't start teaching until August 16th. That's the first day of classes, but I have to report back to work August 6th. So I start back in 3 weeks. So if everything changes, anything changes, I'll let you know. I'm thinking about going on live twice a week in the future, so that way people who can't catch me one day can catch me the next day, or catch me both days, or whatever happens to be. But I'll be going on live twice a week during my breaks. So like if I have like the Christmas break that I have, the holiday break, I'll go on live twice a week then. If I see where I can finagle in my schedule during the school semester, I will do that. But it's going to be hard, just like it's hard for you all because you have classes. I have to work. So, and the same thing about your instructors. Keep in mind, if you're being told to read your textbook, chapters 1 through 10, guess what? I got to read the same chapters that I assigned because I got to know what to teach you. So we are equally as busy. So, oh, Miss Bishop says the same thing goes for some of these nurse residency programs too. What do you mean? What do you mean? They pay you, or what do you mean by that? The same thing goes for some of these nurse residency programs. Oh, you're welcome, Truth Teller. I ICU for me. So ER is chaos. ICU is organized chaos. You just pick your poison. Because keep in mind, the ER is the portal of entry to the hospital, right? So the ER is the portal of entry. Now, mind you, some people need that. They like that adrenaline rush. So that's what you like. Then that's where you need to be. So the ER and ICU nurses always have a beef with one another. They who's the best, whatever. They always have a beef. But ER is the portal of entry, so they don't know what's going to walk in at any point in time. By the time you get to the ICU, it's been filtered through. You've already been filtered, meaning that okay, the worst of the worst go to ICU. So you already know the kinds of patients you're going to get. But in the ER, you can have somebody coming in with their head in their hand, and y'all got to figure out how to put it back together if they make it. So you can have that. You can somebody coming in with who is homeless. You can have somebody coming in who is a mental situation. Somebody coming in who is an MBA. Somebody coming in with a stroke. Somebody coming in who's pregnant, about to have a baby. Someone coming in because they all kinds of reasons why they come in. So for me, I like organized chaos. If you happen to like chaos and you just kind of thrive on that, then ER is for you. But for me, I like organized chaos where y'all done filtered all that stuff out. Now I just got the drug addict, I got all this other stuff I got going on, but it's a more streamlined chaos, more organized. But that's just me and my personality. We need people in the ER who like that kind of rush that they get from that. And if that's you, then that's great. All right, y'all. It's been great tonight. I look forward to seeing you all next week. Definitely comment on the replay or whatever, any topics you want to discuss, and I'll kind of line those up so we can have a topic coming in at the very beginning and discuss the topic. And then after that, then we can just do questions and answers. See, I like if it's like, well, them shows on TV are are edited, and it's not how it is in real life. Um, don't ever. They're great entertainment. Those shows are great entertainment, but don't ever go by them shows to be how reality is. Oh, I see what you're saying. Okay, I see what you're saying. I didn't know that about residency programs. Okay, that's good to know. So I can pass it on to my students that they'll train you, but you have to fill a certain amount of years. Okay, all right, that's good to know. Thank you for that information, Miss Bishop. All right, well, look, I will see you all next week if you're able to come. Like I said, it'd be a roughly about 6 o'clock next week, 6 o'clock Central Standard Time next week. But I'll post it in the tabs. And you all have a good night. Take care. Have a good weekend. I have to work this weekend, so take care of yourselves. Bye.